The LSU Healthcare Network presents Tiger Care, timely, topical healthcare information and education from the member physicians of the Louisiana State University Healthcare Network. Good evening, I'm Jerry Romig, and it's my pleasure to welcome you to tonight's Tiger Care, Louisiana's longest-running health information series on television, and made possible by the LSU Healthcare Network. Tiger Care introduces you to members of the LSU Healthcare Network physician family, outstanding doctors who teach at the LSU School of Medicine and who treat their private patients in clinics across Greater New Orleans, in Kenner, Baton Rouge, Lafayette, and Bogalusa. LSU Medicine, for over 75 years, caring for the families of Louisiana. Tonight's Tiger Care introduces Dr. Luis M. Espinoza, a member of the clinical faculty of the LSU Department of Orthopedics and in private practice at the Orthopedic Center for Sports Medicine and Reconstructive Surgery. Dr. Espinoza is a graduate of the LSU School of Medicine, attaining his MD in May of 1997. He was awarded a fellowship in arthroscopy and sports medicine by the University of California, San Diego, Department of Orthopedic Surgery. Dr. Espinoza joins us this evening to discuss the diagnosis and treatment of shoulder injuries. He serves as orthopedic consultant to the New Orleans Zephyrs, our city's AAA baseball team. And you are most welcome to call in and speak with Dr. Espinoza tonight. The number to call here at WLAE-TV is 866-3200. Doctor, welcome to Tiger Care.
Thank you, Jerry.
Good to have you. And for our audience, he is the son of Dr. Espinoza, a longtime member of the medical family here in New Orleans, practicing in rheumatology. Again, well known. And so we have a chip off the block, so to speak, off the old block. I'm not going to say old block because Dr. Espinoza is not old. He's very active. Doctor, how critical is the shoulder to our body?
The shoulder is probably one of the most important joints that we have because it allows us to position our arm in space. It allows us to reach for overhead activities, wash our hair, do our daily activities, cooking, eating. It's the soul that drives us day to day.
Now, when I think of the shoulder and all of that movement, is there some kind of axle grease, literally? What keeps the shoulder moving smoothly?
It's a very, very complicated system that involves, in fact, the shoulder is the most unstable joint in the whole body. If you can imagine a beach ball that would have to be held up against the wall, it's a very complicated system of tendon and muscle that allows the hood to form over that ball and compress it into the socket where it belongs to allow it to articulate. Mm-hmm. So this would be a model representation of a right shoulder showing the bone with the representative ball and socket joint. This is the scapula, mm-hmm. and the rotator cuff, which allows the head to remain in place, is a series of 4 muscles which encompasses the front of the scapula, mm-hmm. the top, the back, all the way through, and that sends a tendinous hood that attaches to the bone and compresses it in and allows it to rotate in a variety of planes. So, and position it.
Obviously, a reduced reduced size of an actual shoulder, and a reduced size, obviously, of the shoulder blade, what we refer to as a shoulder blade.
By some. This would not be a full model version representation, but not too far off. Mm-hmm. In the body, of course, you're thrown off because of the layer of muscle, fat, skin that would cover all of this. but the essence is right here.
And again, what is it about the shoulder that makes it so susceptible to injury? The fact that it is in a sense loose, that it is
correct,
not anchored, so to speak?
The inherent nature of the shoulder is to provide motion, to allow the arm to move in various planes and allow it a lot of freedom. If you take the elbow, it's basically just a hinge joint. The hip can rotate, but it's so constrained that the motion is much more limited. The shoulder almost gives you full freedom and to work over your head, below the neckline, out to the side, behind your back, and allows us to do everything from pitching to playing football and doing any kind of overhead activity as well.
Sometimes people are referred to as being double jointed. Is the shoulder such an animal?
Joint laxity, or people who are double jointed, tend to have ligament looseness throughout their whole body. So whether their knee hyperextends, whether the elbow can straighten out more than just straight, the shoulder is no different. If you have laxity or looseness in your tissue, then you're at a higher risk of allowing that ball and socket to disengage and dislocate.
Are athletes the most prone to a shoulder problem, to a shoulder injury?
Contact athletes, such as your football players, sometimes basketball players, those would be the athletes among the highest risk group.
Because football, for example, because your shoulder can literally, by brute force, be knocked out of its joint?
Correct. So what happens, a typical position that you will find a player dislocates would be an overhead activity where you're stretching out for a foul ball, you come down hitting the turf, bouncing the shoulder, and it's an external rotation and abduction move. So essentially a cocking motion that would allow this ball to essentially come up and fall out the front. 90% of all dislocations will be anteriorly directed. Only 10% is the ball actually dislocated posteriorly or in the back.
And when it falls out of that joint, it's just laying there against laying interior flesh?
Correct.
It's holding it in some form of...
So we just said there's a hood of tendon and muscle that helps compress this into the socket where it belongs. If you have a violent maneuver where your arm goes up and gets forced out, that tissue is going to be stretched out. It's still trying to compress it and keep it in place. And so sometimes the arm will actually be stuck in this position, and it requires prompt recognition so that you can maneuver it and work it back into place where it belongs to allow those soft tissues to heal, to keep it from remaining stiff and having problems with looseness and laxity down the road.
You know, you hear that someone has had a shoulder dislocation. To the layman, it sounds, oh, that's relatively simple. They can be put back in place. It's really not a simple problem.
In fact, the biggest misconception, and on proper history taking, when a patient comes into your office, you want to truly assess the ones who feel the shoulder is popping, because you can have popping for a variety of reasons, whether it's your biceps tendon, whether it's scar tissue, whether it's inflammation. So those are the ones that you really want to pin down and say, okay, what were you doing at the time of this dislocation? If they're just rolling around the bed, chances are it's not a true dislocation and it's something else. But if it was a contact injury, or if they had a history of having the shoulder fall out, typically those are the ones that you have to be suspicious for. And also you want to make sure that they had to go to an emergency room or have someone place it back in place, because the ones that come out on their own generally do not spontaneously pop right back in.
So by and large, a shoulder injury is going to happen from some form of brute force.
Right, unless you end up being one of those people who have joint laxity and are double jointed. Those, or particularly swimmers, volleyball players, those are the ones who tend to have loose joints, especially shoulders.
You hear someone often say, and you just mentioned it, my shoulder popped out of joint. Does a popping sound actually occur?
A lot of times
you can hear it?
You can actually hear a pop, and it can be reproduced. In the clinic, for example, the biceps tendon comes in along the front of the shoulder and actually dives in through that tendinous hood to attach deep into the socket joint. As the arm comes up and gets rotated around, that tendon running along the front can get pinched along the roof or the acromial part of this bone, and that can result in popping or pain or catching that the patient can hear and feel, especially with overhead or rotational motion of the arm.
And it's actually a pop sound.
It can be a click or a little pop, but a lot of times it's subtle, not generally, you can't hear it across the room, but you can definitely feel it if you lay your hands on the shoulder, if you examine the patient carefully, and at times you can hear it if it's quiet and you pay attention.
Can you physically manipulate a dislocated shoulder back into its position?
Sure.
Without, on the field of play?
Yeah, in fact, in my own short career, I've been called upon to do that in a few instances, with just providing coverage around schools in town or as a resident training. If you have a case, generally the player is going to be down in severe pain. And the position of the arm is very characteristically rotated to the side, and they don't want to move it because it hurts. So what you have to do is first try to get them to relax, really get in and get their awareness, let them try to relax and gently maneuver it back. The best time to try to put this back into place will be early on, if you can recognize it and avoid that tissue from scarring down.
It's not one of those situations where you say, this is going to hurt me more than it's going to hurt you.
Well, you could tell them that, but they may not believe you.
But it can be placed back into position.
It can. Now you have to be very careful.
What would you do after? What do you tell them?
Okay.
Come see me tomorrow. Let's have an x-ray.
Well, the first thing you need to do, I'm sure covering the Saints, you know, you have to go on the field. You try to do your best to get it in place right then and there. You help the player up, you move them off to the sideline, and then it's critical to really do a good assessment of the strength. The earlier you can get to that shoulder, the less swelling, the less pain, and the better representative exam that you can do on that tendon, on the muscle, to see if there's any deficits. You also have to do a good neurologic exam to see if they can feel everything, to make sure they don't have an associated stinger, which is a stretch of the nerve that can occur with a lot of these violent hits. So you have to recognize that early on and assure that the shoulder is back in place, and always confirm with x-rays. If not that same night, definitely the next morning in an injury clinic or in some type of setting.
You can actually feel when it happens, when the event happens that the shoulder is dislocated. And you, as the doctor, can go on to the field and grab hold and sense where it's dislocated and physically move it back up.
When that bone is out, 9 times out of 10, unless they have really loose tissue, you will be able to feel that come in. And the way I describe it to patients, it's not a click, it's not a little pop, but it's actually a clunk. So if you were to imagine taking your knuckles together and lining them up right on each other and then rotating them off the side, that is the type of sensation that you will feel when a dislocated joint pops back into place. Same goes for the knee.
Very painful though.
Right.
Interesting.